My name is Allison Moon. I'm a veterinarian here with CareFirst Animal Hospital. I'm also certified in veterinary acupuncture, and I just wanted to take a moment and answer some of the common questions that I get from clients. So I became interested in acupuncture before I went to vet school. I was shadowing an equine veterinarian, and she was in the process of becoming certified. And we did a farm call and saw a horse that had a really bad lameness in its front leg. I saw her do the session, and then afterwards the horse was walking really well, and the lameness was almost not detectable, and it really caught my attention. In my mind, I just thought that acupuncture was a placebo effect, and obviously with that horse it wasn't, and just really sparked my interest. I started reading some books, and then I went to University of Florida for vet school. There we actually have an acupuncture and Chinese medicine program in the hospital. When you put the little tiny needles in, and I'll show you those in just a moment, it causes a local response, and each of the points are very specific points on the body called acupoints. There's a cluster of nerve endings, there's also some blood vessels and immune cells, and you stimulate a local reaction. You actually improve the immune function at that area in the blood supply. The free nerve endings actually take that message up to the spinal cord and on up to the brain. And that way you get the systemic response where you get endorphins, which are really important for pain relief. And at the brain function, it can stimulate some hormones in the body. One of those is an anti-inflammatory hormone. And then others kind of help the body get back in its check and balance system, something called homeostasis. And then signals get sent back to the area where the needle is and helps improve the muscle relaxation, which can be a really nice thing for diseases like disc disease, where you're having muscle spasms that are really painful. The gauge of the needles is very tiny. These are gauge 34. I typically use gauge 32 and 34. Compared to our vaccine needles, they are much smaller than those vaccine needles. The length of them just really depends on the size of the pet. And then lastly, I've got these needles. These are a little bit different. They've got a plastic tip on them, so electroacupuncture, I can't use that with these, but they're very flexible and they're very soft. And so for pets that are very nervous or really have painful conditions, then I'll usually use these on the very first treatment, just so that the pet's not so nervous and can relax and get more of the benefits of the acupuncture treatment.
My name is Tom Miltz. This is my dog Radar, and about 2.5 months ago to 3 months ago, he was having a lot of difficulty getting up and moving on hardwood floors. He was falling a lot and just didn't have any stability. And we started this, I think it was like 4 times within the first month, and then we went to about every 2 weeks. And we've noticed since we've been doing this, the first time there was improvement. About a week later he was up moving better. And then after about the last treatment, he was where he could actually pull, and you could feel on a leash, actually feel that he was digging in, which he couldn't do.
So I'm gonna just do a demonstration on a typical acupuncture appointment. So the first point I put in is just to help them calm down and relax. And how I choose points on the body is based on when I first do their consult and their physical exam. I'm looking for sensitive areas of their body, and also the color of their tongue, and also the quality of their pulse. And most pets become tired during an acupuncture session, but I'm just going to slowly feel over his back, and all the points that I use by just palpating the pet and feeling their normal anatomy, and I know where the points should be based on their anatomy, and I find them by counting vertebra and going several finger widths to the side for the back points. These points around the hips I'm doing for him because that's one of the local areas of his body that he gets painful with. And there's certain points on the body that are more associated with special functions and improving stamina. And one of those is at the knee. It's called stomach 36. So we typically use that one for Radar, just to help give him a little boost of energy. Okay, so Radar has his needles in now, and I'm going to demonstrate the electroacupuncture machine. And so it is a TENS unit. And so it's a low voltage, high frequency machine, and it's really good for just stimulating the needles a little bit more. So the clips are attached, and I typically will attach them going from one side of the body to the other, especially if there's one leg that's worse than the other. I'll attach the leads between the bad leg versus the good leg. We also typically will attach them from the front of the body down to the back of the body. What I want to do is turn the unit up just to the point where the pet tells me that they're feeling the stimulus, but not where they're going to be uncomfortable. So I'm just going to slowly turn these on, and I start out with a lower frequency. That frequency releases more of the endorphins and helps them feel better, and then I go to a higher frequency that produces more of the long-term opioids and also serotonin. So he's going to sit for about 5-10 more minutes, and then we'll take out the needles and he'll be done. So thank you so much.
Like I said, it seems like it's been really great. His quality of life's up, and he gets to go outside and move around, so we're pretty pleased with it.